So welcome everyone, good evening, and thank you so much for joining us for another in our series, COVID-19 Law and Social Justice Community Conversations. I am Wendy Parmet, the Faculty Director for the Center for Health Policy and Law at Northeastern University School of Law. And so glad to have you all join us today. We're doing these conversations on Monday nights, non-holiday Monday nights through the fall quarter. And to just give you some coming attractions, on next Monday, we're going to be talking about elections and the pandemic. And Jeremy Paul will be our speaker. That seems timely. The following week on November 2nd, Margot Lindauer and Morgan Wilson are going to talk about domestic violence and the pandemic. And then on November 9th, we're going to stop at least for the end of the fall quarter. We'll see if we take it up again later with Brooke Baker and Jonathan Kahn talking to us about vaccines and equitable access. So some great conversations to look forward to. I am really thrilled to have everybody join us tonight, and I'm really thrilled to have our speakers, Leo Beletsky and Jessica Bresler. Leo, of course, is on the faculty of Northeastern University School of Law and also of the Bouvet College of Health Sciences. And Jessica is a 2020 graduate of Northeastern University School of Law, and perhaps even more important for present purposes, helped work with us over the summer on putting together the legal assessment, the comprehensive legal assessment of sometimes called the playbook for COVID-19, and has also worked with Leo on the chapter on carceral systems. So super excited to have both of them speak with us. This is an informal conversation, so I'm sure they will leave plenty of time for questions, comments, conversation. So thank you so much, Leo and Jess.
Thank you so much, Wendy and Jennifer, for putting this together. And I am hoping that my internet is working well enough for me to sound and appear non-combobulated, but if you can't hear me, please just wave at me. So really appreciate the opportunity to speak with all of you about the role of carceral systems as a determinant of COVID-19 spread and control. We've had some great conversations about the healthcare worker safety from Mike Singha and racial justice from Aziza last week, or I guess 2 weeks ago, actually. And overall, the focus of these discussions is really on the ways in which COVID-19 has really shown a harsh light at the various fissures in our society, the various ways in which our society is dysfunctional, and that has really fueled the spread and has impeded the control of COVID-19. So Jess and I collaborated on a chapter for the playbook that Wendy mentioned about the role of the carceral system in this overall larger picture. So thinking about the role of criminal law and the criminal legal system as a structural driver of COVID-19 spread and ways in which it has impeded efforts to control this pandemic and many others. And we're not going to be providing a detailed overview of that report, but invite you to review our chapter. I think there's a link in the chat looking over the kind of various ways in which the carceral system, and when I say the carceral system, I really mean kind of the universe of institutions and laws that are designed to discipline and punish people through the criminal legal system. So we really are talking about the entire continuum from police encounters to jails to prisons to the probation and parole system. So there's kind of there's various ways in which you can visualize it as a continuum, or maybe more often a cycle that people are caught in. And as you probably all know, the carceral system plays an outsized role in the lives of people who live in the United States. We are the world's largest jailer, but the just the incarceration system in and of itself is only one small component of the carceral system. In fact, about 70% of people who are under the control of the carceral system are not behind bars. So even though we do put a lot of people in cages, we also put people in a lot of virtual cages through either electronic monitoring or through the probation parole system. And all of those efforts of controlling and surveilling people play a role in COVID-19 spread and impede efforts to control this epidemic. I wanted to stop, take a moment and give Jess the floor to talk about specifically just very brief overview of what our report, what our chapter focused on, and then maybe have a few more remarks and open it up.
Thank you, Leo, and thank you, Jennifer and Professor Permet for hosting this. I think I'll start by just kind of echoing what Leo was saying. You know, one of the things that COVID has shown us is that, and this is something that we knew before the pandemic, but contact with the criminal legal system at all points perpetuates health harms in particular. And in the context of a pandemic, and this is what our chapter really focused on, it necessitates a reduced interactions at each of these points, but most acutely in carceral institutions where COVID-19 spread can just, run rampant. And importantly, the effect of the correctional settings is very illustrative of the broader carceral system harms. We know that that carceral systems are largely filled with people who are financially burdened, people who are low income, people who are Black, Indigenous, or other people of color. And these disproportionate demographics are reflected also in the spread of COVID, and particularly in COVID mortality. So we know that if there are more people, if there are more BIPOC in carceral settings, that means that, and there are more BIPOC who are having negative health outcomes within COVID, that those two trends are going to be very similar, regardless of whether they're behind bars or in the community. So we talked about how jails and prisons are structurally designed to become hotspots due to overcrowding, insufficient sanitation, bad ventilation, inadequate or frankly non-existent healthcare. And they become breeding grounds when you add a highly infectious airborne disease to the mix. We also know that mortality rates are way higher in jails and prisons. So in the overall population, we have about 1.5 to 2% mortality. That number fluctuates, but in jails and prisons, the data that we've been able to obtain, it's closer to 10%, which is really distressing and sort of illustrative of the issues that the carceral system poses kind of generally. I definitely want to leave time for a good, robust conversation and questions, but I will just briefly end by saying that our overall recommendations are really centered around accelerating decarceration efforts using administrative, executive tools, but then simultaneously ensure that there is increased reentry support, um, particularly providing access to shelter and services upon release. And shelter is something that we're all thinking about, I'm sure, since the eviction moratorium has sunsetted. But having safe housing to effectively quarantine, to maintain social distance, and to just have that baseline of support and stability is really crucial at any time, but particularly in a pandemic. So leave it at that for now.
Yeah, and I wanted to thank you, Jess, for that overview. I wanted to also just very briefly add to emphasize the disparities angle, which is that we've known for a long time. I hope it's no surprise to anyone that the carceral system has very vast racial and ethnic disparities and has a disproportionate impact on people of color, BIPOC people. And that is one of the mechanisms through which we've known other infectious diseases to disproportionately infect these populations. So HIV and tuberculosis and other infectious diseases. And that is exactly what's happening with COVID-19, where essentially the racial disparities in the carceral systems are being translated into disparities in infection and fatality in with COVID-19 more broadly. I also wanted to mention that this pandemic clearly illustrates that the often held view that carceral settings are only affect people who are inside, and a lot of the policy solutions and legal solutions oftentimes essentially erase people who are incarcerated because they're seen as less than, and they're sort of othered, and they're oftentimes forgotten. But what's happened with COVID-19, and again, this is an illustration of a broader paradigm, is that the fact that these facilities are hotspots has also affected the broader communities in which they're sited. So a lot of the, oftentimes prison facilities, detention facilities are seen as kind of a boon for a lot of rural areas, and kind of like a jobs program and sort of a cash cow, including issues like prison gerrymandering, where a lot of times the populations of folks who are incarcerated are counted towards resources for that community, but those folks are not allowed to vote. So it's kind of like almost, it's almost like a population hack in a way. In the context of COVID-19, the infection hasn't been able to be contained within these facilities. And they, obviously, these are not really secure facilities in the sense that they can't keep an infection like this completely inside. And so a lot of times the prison staff, the medical staff, the correctional staff have gotten infected, and they've seeded the communities in which they are located with infections. So a lot of these communities have very few healthcare resources, and are affected by hospital closures and other kind of paradigms in the evolution of American healthcare. And so there's been a number of instances where these facilities have actually sparked the outbreaks outside their walls. And you know, they present a lot of occupational health issues for correctional staff. And then finally, I just wanted to link this conversation to the broader discourse that's happening around, you know, questions about public safety and the role of carceral systems in our societies. It's been kind of primarily focused on policing, but the point that we make really is that in the chapter is that you know, these discussions really should be focusing on broader carceral systems of punishment and control, and that you know, these are the very same systems that cascade into police brutality, which is, you know, kind of the only the tip of the iceberg, and many of the same patterns that you see resulting in police brutality, police use of force, and the killings of Black and brown people. You know, the situation with COVID-19 in these systems in many ways is a symptom of the same disease, figuratively speaking. And so I think that there's, you know, a conversation about the role of these systems in our societies is very timely, not just because of COVID-19, but also because of the Black Lives Matter movement. So any questions, feedback?
The chat. One
Can I ask a question? Sorry.
Yeah, sorry. Go ahead.
I'll ask a question just to get it started. I know, has there been any progress at all over the months of the pandemic with improving the safety situation with inside carceral institutions? So, you know, short of taking people out of them, have they done any better job of infection control over time?
I think Leo can probably speak to this better than I can, but I will say that what has been done, much of the burden is falling on folks who are incarcerated to implement these measures, which can include you know, being responsible for your own masks, their cleanliness, sleeping in them to avoid spread, complying with various measures to reduce spread, such as no longer having communal dining situations, which means that folks are forced to eat on their beds, which often, if they're in large congregate settings, is no better than being in a dining hall. But I'll let Leo kind of say more about that.
Yeah, Wendy, great question. I mean, I think this maps out onto other failures in pandemic control, where it's not like we don't know what to do. It's just we're not willing to do those things. We just can't get our act together. So interestingly, from a legal perspective, there are laws on the books pretty much universally across the United States that would authorize the executive branch to rapidly decarcerate in a context of a pandemic. And these laws have been on the books from, you know, for over 100 years in many cases. However, the same carceral impulses that have impeded progress on criminal justice reform have been at play now, in a sense that a lot of people in power, including our own Governor Baker, have essentially said that, you know, they can keep people safe inside correctional settings, and have resisted calls by epidemiologists and advocates to rapidly decarcerate, even though, there's no legal impediment really. Um, uh, uh, in addition to, other tools that are also exist that are non-specific to infectious disease, such as, power to pardon and parole folks. And so as a result, very little progress was made and in decarceration and relieving the overpopulation of carceral settings, institutional settings. And what has happened is that I think out of the 100 biggest hotspots in the United States for COVID-19, something like over almost 90%. I don't remember the exact statistics, latest statistics. What is it?
More like 80%.
80% of those hotspots are prisons or jails. Cook County, for example, has been huge. In Massachusetts, there have been outbreaks. Right now, there's an outbreak at the Plymouth,
In Middleton.
Middleton and Plymouth Massey, which is a Department of Corrections facility housing people who are involuntarily committed for substance use, which is a different, like, these folks are not actually, they're under the jurisdiction of Department of Corrections, but they're not in for any criminal infraction. They're involuntarily committed for substance use treatment, which in fact, is just essentially, Wendy and I have written about this. So, anytime that you are institutionalizing folks and there's lots of people in a small space, you're running the risk of an outbreak. And the predictions that people had made about these settings have come to pass. And lots of people, unfortunately, have died. And many of these people who have died, you look at their stories and it's just, not that anyone deserves to have a criminal sentence turn into a death sentence, but, a lot of these folks who have died were in for either they're held pre-trial, so they're not even convicted of a crime, they're just too poor to post bail, which shines a light on the fact that we have a cash bail system, which is completely unjust and absurd. Or, like the first person who died, well, Jess, maybe you can talk about the...
Anthony Cheek, prisoner in Georgia, 49 years old. I don't recall why he was incarcerated, but that was in March, end of March, and the situation has not been made any better. To Leo's point about it spreading to the communities, we have, I think that Mayor de Blasio in New York City just recently said all cops must wear masks. This sort of this, what I perceive as callousness towards communities that are being policed, but also like people who are in these carceral settings. It is no wonder that the infection rates are so high. And again, very much, I believe, illustrative of how the carceral system treats people, particularly people of color, people who are financially burdened, and people with substance use, chaotic substance use, and other mental health conditions. So, and I'm not sure if Leo might have lost connection, but another thing too is that, testing only ramped up a couple months ago. And when it did, this mass testing programs within carceral settings, it resulted in a 12 times increase in the number of known infections. Previously, they had been relying on symptoms-based testing. And the other component of this is, if you aren't regularly testing both people who are incarcerated and also staff at the institution, then each of those people, if they are released, or if they go home, can be unknowingly spreading into the community, and without comprehensive testing programs, you're essentially letting that go unchecked. So yeah.
That's great, thank you. So I think, Brooke, you had your hand up, and then I know Margot wants to ask a question, and then John. So I'm keeping a list, but Brooke, if you want to go ahead.
Okay, well, I'm trying to figure out which of 4 questions to ask, but I'm not going to ask all 4. So I'll start with one. So, I think one of the things that people have thought about is, well, maybe we ought to focus on the most at-risk populations, that is the most at risk of severe disease or mortality. So they're talking about, letting older prisoners and prisoners with comorbid conditions to, out early. And of course, at the front end, people are petitioning the courts to not be incarcerated. They're said, put me in chains at home. That will be a good solution. So, and that has, for some people, I think a facial appeal as the solution to this problem. Okay, you say prisoners are dying, so we'll try to address the most at-risk population. I don't think that's really what you're getting at, but I wonder what your thoughts are about that kind of focus and the kind of response, which is, okay, let's deal with the most at-risk population, and the rest of it will sort itself out.
Yeah, I think one of the things we talk about in the paper is how there are all these sort of quote unquote low-hanging fruit options to reduce health harms, to decarcerate, to provide better supports in the community, both pre and post incarceration or contact with the criminal legal system. And it's certainly something that I think that executives should be thinking about when they're considering their pardon power, when they're considering, mass decarceration orders. But there's an equally, I think, important point to be made that, yes, age, yes, people with comorbidities it is important to protect them and to pay them special consideration as we, try and convince these systems to decarcerate. But, the fact remains that most people who are in jail and prison, like Leo said, they're being held pre-trial. They're being held, for very low offenses. They're being held on crimes of poverty. And if I think we focus on sort of I think that saying that there's a most vulnerable of the most vulnerable, that it doesn't make a ton of sense to me to break out folks, even though like they are of course at risk, but everyone is at risk. The first person to die, Anthony Cheek, he was 49 years old. I mean, that's not close to the 65 to and older stat that we've been hearing is like the most at risk. I don't know, maybe Leo has other thoughts on this.
No, I totally agree. But I would say that, there's a kind of a dual imperative, which is to most urgently to reduce the harm of these systems by making these, technical tweaks and improving healthcare inside, improving, decarceration efforts, but ultimately, COVID-19 is just one of the health harms that cascades from contact with the system. And so we need to do much more to prevent contact with the system altogether. And so, we actually do some of this work with on a policing side, because policing is really kind of the tip of the spear for the carceral system, and try to figure out ways in which we can minimize any contact that members of the public have with police, which again, has actual benefits way beyond the individual, infection risk for the particular people. It also has an occupational safety benefit for police because they're interacting with fewer people. And it has lots of community benefits as well in terms of infection rates and so forth. So overall, the idea that we need to shrink the size of carceral systems, policing included, fits very well with the discussion of how to better respond to COVID-19. There's so many vivid illustrations in which, the fact that our carceral system is so metastasized, is really an engine of infection in the community and so many other harms as well.
Margot, did you have a question?
Yeah, thank you both. This is incredibly informative and helpful. I'm wondering if either of you can speak to two things. One, the number, or like whether or not there is PPE. I also agree with everything Leo said about lessening contact with the system and like getting people out of jail. But right now we are living within a global pandemic and there are many, many thousands of people in jail right now and prisons. I'm wondering if you can speak to what it looks like in terms of PPE and distancing in carceral settings. And I'm assuming the answer is not great and no distancing because it's impossible to distance in that sort of setting. And if so, kind of what alternatives other than decarceration efforts have been suggested that you believe could be potentially more effective than what's going on now?
Yeah, great question, Margo. So overall, you're right. The situation is pretty dismal. And again, the COVID-19 shines a harsh light onto existing realities, which in US carceral settings include things like the fact that there is no soap to wash your hands. You have to buy soap for what is often equivalent to your 2 months of wages. I mean, it varies, but it's like incredibly expensive given how much people are getting paid to buy your own individual soap. And so if you don't have soap, that's a basic hygienic precaution for a variety of things, including COVID-19. PPE has been incredibly hard to come by, and in a very sort of almost Shakespearean irony, there's been cases where people in carceral settings are working for slave wages, making PPE and making sanitizer, but not able to avail themselves of the products that they're producing. In many cases, the wardens and other correctional officials have stated that, they are in response to litigation often, which, claim that people are not being kept safe inside correctional facilities. They have testified that they, of all the measures that they're taking to protect people who are in their custody. And there's been really absurd statements such as, we're having people sleep on the same bunk head to foot, and therefore they're maintaining social distancing.
That's not how science works. And in addition to that, Leo, you shared that PDF with me of the steps that they're taking at one Massachusetts, setting, and it includes, and this is for their COVID response, it includes ice cream socials and free phone calls, which I love ice cream. We need to stop this practice of charging people who are incarcerated and like the people who love them and their lawyers and people call them. We need to stop charging them for the privilege of using a phone. But to think that that is included in this sort of not at all comprehensive plan to ensure, COVID safety it's insulting to the folks who are living there. And
Just wondering if it's more nefarious than even that, because since the origins of incarceration, people have died from unnecessary exposure, viruses, and illness in carceral settings, and we as a society don't respond to that. And I'm wondering if this is getting a little bit more attention because it's all happening more or less at once. But I don't know.
I think I also have a tendency to think that there is more cynicism, like to be more cynical and think that there's more going on. But I honestly think that it's born of a lack of disregard, both for the people who are incarcerated, the people who love them, and the people who work at those facilities. It's just a general lack of disregard, coupled with not knowing like the basic science stuff, and in terms of alternatives, more frequent testing. The president touts that we have the highest amount of testing anywhere of anyone, or something, and like, why are we not applying that to these places where we know are hotspots, where we know there are large congregate settings, and I guess one other point that I want to make is that often people who become involved in the criminal legal system do so or become involved because they have either chaotic substance use disorder, or some other mental illness, whether it's serious or not. And without kind of commenting on the criminalization of mental illness, the criminalization of poverty, and all of those, correlations, I think that our society says to, people who struggle with those challenges that you are not worth spending time on. You are not worth investing in. Your safety is not as important as our safety. And the unfortunate thing about the virus is that it doesn't discriminate on, like, in terms of it is as infectious for one person as it is for another. The way that we deal with it makes it so that there is a disproportionate impact on financially disadvantaged folks and people of color. But the virus itself is as easily transmissible to a person who is incarcerated as is to a person who is working in that carceral facility. So there are a lot, as Leo and I keep saying, there are a lot of structural issues that make it so the virus is so transmissible, but these are things that have existed, as you said, and will continue to exist until we disrupt that system and start reducing instances and interactions with the criminal legal system.
That's great. John, you had a question?
Yeah, I have, I guess, sort of one brief question and one slightly less brief observation. One is just wondering if you found sort of, some jurisdictions that seem to be doing, at all better than others, and sort of like, what they're doing. And the other was just thinking about part of this discussion reminding me of an article that Dorothy Roberts wrote, God, I don't know, like at least 10 years ago, maybe longer, about the sort of the iatrogenic effects of incarceration on communities of color, on the health of communities of color, about how it's sort of like literally, disrupting the health of the community by taking, generally, young Black men out of the community, and sort of like how that has ripples, right, for the people who are sort of left behind. And but thinking about how this is sort of this example, especially if you have people being decarcerated, the problem of this sort of being literally iatrogenic as well, in the sense of how do you manage the dangers to these same communities that you're trying to protect, that of either through decarceration or just through the natural, like, people get out of jail or get out of prison and re-enter their communities disproportionately. and whether there are any initiatives about for like following up after people have left and they're going back in their communities, sort of, and whether they're sort of, you know, sort of ripple hotspots in that sense, I guess.
Yeah, great question, John. So, yeah, I mean, whether or not there's a major decarceration effort, you're always going to have churn. Lots of people churn through the criminal legal system. And like I was saying before, you know, most people are not behind bars, and a lot of those folks come in for probation violations or other stupid reasons, and then they get released. So there's already, you know, short of major decarceration efforts, there's already lots and lots of interfacing between carceral settings and the community as a whole, which is why, as Jess was saying, we really made a major emphasis in our report on housing, both transitional and other forms of housing, which is you know, central to pandemic response as well as many other health issues. I mean, it's one of the most critical structural determinants of health, and it's again on display with this pandemic. The fact that we don't have housing for folks. A lot of folks transition through, you know, these halfway house systems that are a major driver of health harms in the best of times. People who are released from incarceration are 50 to 130 times more likely to die of an overdose within the first 2 weeks of being released. And this is because they transition through these housing and other structures that put them at higher risk, and also because of you know, various failures in providing quality treatment while people are incarcerated. But this is, you know, again, an illustration of how we're failing people who are churning through this system in regular times, and especially during this pandemic. As far as the kind of the network effects, so there's, as you said, there's lots of research looking at social network disruption and how that affects sexual health risk and substance use and other kinds of risk, and that you know, ripping people out of their community makes the whole, like, affects the fabric of that community in a way that makes that community more vulnerable to various health harms. And I think that, you know, again, the less people come into contact with the carceral system, be it police, jails, prisons, probation or parole, you know, other forms of detention, the better, not just for those individuals, but also for the community at large.
One other aspect of this is the level of distrust, I think, that many communities have towards the carceral system, and that would be, I think, most profound in its detriment in terms of contact tracing. So I am coming out of prison. I am told that I have to quarantine for 14 days, and I need to, you know, be available for contact tracing. So beyond my general distrust of the system that just incarcerated me for however long, that probably didn't treat me very well, that probably exacerbated a lot of my pre-existing health conditions, or, you know, mental health conditions. Beyond that, I might not have a cell phone that I could even provide to you, or a phone number that I could even provide to you, contact tracer, to say like where I am and who I've come into contact with. I might not have a place to safely quarantine for those 14 days, or I might have requirements, parole or probation requirements that force me out of quarantine or isolation, such as having to go and interview for jobs, or show that I am, you know, job searching, or meeting with my parole officer. And, you know, many of those things are being done virtually on Zoom or other platforms. But if I don't have a computer, how am I going to do that? You know, many people, they use public resources, so public libraries or you know, places like that to have access to a computer without, you know, any other options. Public libraries are generally closed. They're not allowing folks to use the computer. So the system, both within and outside, it really sets up folks for failure, both with respect to recidivism rates and how, as Leo was saying, it is more cyclical than it is linear, but also in terms of, you know, my health and not being able to do the things that that would promote maintaining my health, or, you know, maintaining the conditions of my parole or probation or early release.
Yeah, and I just want to echo what Jess is saying by pointing out that, you know, these systems of surveillance and oppression that oftentimes are imposed on people who are in criminal justice involved are also antithetical to a lot of the, you know, the public health measures to control COVID-19 spread, including things like, you know, Jess was describing, you know, regular and sometimes random visits with the community supervision system. Oftentimes that includes random drug screens. Those are not, even now, are done in person. And, you know, it increases the number of people who are circulating through the community, included, and increases the number of human contacts. You know, urine drug screens are done at a very close proximity. Like, there's actually, you know, the role of the parole or probation parole officers is to actually watch people as they relieve themselves. This is how invasive the system is. And, you know, that's obviously not something that is very amenable to social distancing. And there's just one illustration of the enormous number of rules and regulations that govern the lives of these folks. And that is not something that is facilitating COVID-19 prevention or response. And as she was saying, you know, privacy concerns and concerns about one's legal status really do impede transparency. You know, if people are saying, you know, contact tracing, for example, how does that run into issues around the conditions imposed by probation or parole? If you're not supposed to interact with certain people or be in certain places, you're not going to be totally forthcoming about what you have done in order to help contact trace. I mean, I guess it's probably a little bit less relevant in the current environment where contact tracing ostensibly is just like not happening. So, you know, if it were happening, then it would, you know, it would really not jive well with probation parole conditions. But that's, you know, different story.
But of course, contact tracing is something that is so important in terms of COVID-19 spread, and that we're not doing that. It makes me worry that the response is going to be, well, of the one population that we can do this with, folks who are exiting jails and prisons, like those are the ones that will actually contact trace, and it is both harmful and also it runs against the public health measures that that we so desperately need.
So we have two more questions, Wendy, and then if we have time, Megan.
Why don't you let Megan go first, because I already asked one.
Okay, great. Megan, do you want to go?
Sure. My question was, have there been any initiatives to amplify the voices of those currently incarcerated on their most salient needs? And what are grassroots and community groups doing to to support decarceration efforts and increase access to COVID resources during this time?
Yeah, there's been lots of activism. There's a couple of really great podcasts that are produced by folks on the inside. There's been some contraband video that was smuggled out about sort of the chaos inside correctional facilities. But overall, I would say that the action, sort of the response, even despite this very lots of different activists calling for decarceration, there's really been very little action, even in places that are ostensibly progressive. Massachusetts being one, California being another. I mean, the number of people in California prisons are also under a consent decree to decarcerate already. But the number of people who've been released is actually the actual number is sizable. It's several thousand, but in terms of the percentage of the population and the number of facilities that are over capacity still, like 120, 130% capacity, when they really should be at like 40 if we're going to be consistent with CDC recommendations, that number remains large. And, there's been really frustrating kind of media coverage around decarceration as well. There was one case in Miami where someone was released and subsequently committed a crime. They weren't actually even released for COVID-19 reasons. They were already supposed to be, they qualified for early release. And the coverage around these kinds of situations, plays into this kind of Willie Horton trope where, okay, well, someone was released and they did a bad thing, therefore we shouldn't release people. And it really sends shivers down the spine of correctional officials and politicians. And that impedes progress on decarceration, both for this particular reason and for others. And so, so there's been concerted advocacy both from inside and outside these institutions. There's been hunger strikes. There's been a lot of various direct actions, but unfortunately, they have not resulted in a lot of tangible activity in terms of really major push to decarcerate. Pretty much, and this goes back to John's question. There hasn't really been any jurisdiction that's made, sort of the right, sort of a commensurate decarceration push. There's been, some places have done more, some places have done less, but overall, there's been a very meek response, and it's frustrating because in many ways this is a time of opportunity. We've been talking about the imperative to decarcerate for racial justice reasons, for fiscal reasons, for civil liberties reasons, and for health reasons before COVID-19, and it's an opportunity for us to do that right now. And in many ways there's like a very rare confluence of interests where, for example, criminal justice reform advocates and correctional officer unions are on the same page sometimes. That almost never happens. Actually, it never happens.
It never happens.
And there's been instances where the correctional unions have said, why are we not doing what we know will protect our officers? And even with these kind of strange bedfellows, progress has been very frustratingly glacial. So it's frustrating.
There are a number of organizations who are doing data tracking, both on infections, numbers, mortality, and also people who are being released. So the UCLA School of Law is, they are doing a big data tracking project. I just dropped a link in the chat. There is a tab on that talks about various campaigns to get folks released. The last time I looked at it, that particular tab was kind of sparse, but I know that the ACLU is all over this. They're trying a number of different legal routes for getting people out, compassionate release, Eighth Amendment. And while they've been largely unsuccessful, those efforts have not stopped necessarily. And if you're interested in kind of seeing where this goes, we will be doing a second iteration of this chapter, I believe. So I, for one, am looking forward to incorporating those questions into our next version.
I think, we're at 7:30, so I think I will just thank our speakers, thank Leo and Jess for a really interesting and informative conversation, not necessarily upbeat, I have to say, but definitely interesting and informative. So thank you so much. Thank everyone for coming tonight. And hope to see all of you next week when we talk about how to have an election safely during a pandemic. So thank you, everyone. And thank you so much to Jennifer, as always, for being our amazing organizer and facilitator.